Hi, it's me, Ingrid INFP, and welcome to Medical ABCs. And this time we're going to talk about different common infections. And when do you need to seek a doctor and not? And obviously, it's not going to be a catch-all for all diseases, so take this all with a grain of salt. I do happen to be a licensed doctor. I'm only a resident, but I do have a medical license and I can prescribe medication and stuff. I'm not specialized, but I am specializing in general practice, which, like, to a lot of people that confuses them, but that's how it works, okay? So I'm not allowed to do absolutely everything, but I can do most things. And now we're going to talk about infections. And so I was thinking of starting with strep throat. And strep throat is when your throat hurts, obviously. And so the most important thing is differentiating between when it could be a bacteria, which is streptococcus, and a virus. And so we usually go through a certain set of criteria called the central criteria. And you need to have at least 3 out of 4 of these criteria in order for us to take a swab from your throat and test for strep throat. It's a pretty easy test that only takes like 5 minutes, pretty much. But we don't want to take it on everybody whose throat hurts because that would use up a lot of stupid resources. And also, maybe you don't need to go to the doctor if it's a virus, because there's nothing really you can do about it. It's only when it's bacteria that you can have antibiotics. So the different criteria are temperature over 38.5 degrees Celsius. Now, I don't know what that is in Fahrenheit. Go and Google that. I don't know. 38.5 Celsius. Having a fever that's just slight, that doesn't count. Okay, it has to be over 38.5. Number 2 is red and small white dots in your throat. And that might be difficult to see on yourself. For children under the age of 4 or 5, it's enough to just have a redness in your throat. Number 3 is having a lymph node that's enlarged on your throat that hurts, which you might feel yourself, like if it feels a lot bigger on one side than the other. And what is number 4? Number 4 is, I keep forgetting. Wait. Oh, I just remembered. Absence of cough. So if you are coughing and you claim to have strep throat, maybe it's not a strep throat. So if you have 3 out of those 4, then that's when we take a test. And if the test is negative for strep, then the doctor will decide what they will do with that information. But if it's positive, then you get antibiotics, which is regular penicillin, at least in Sweden. The antibiotic resistance looks different in different countries. So you might be getting other kinds of medication like amoxicillin or other kinds of antibiotics. And so the doctor should also be asking you if you're allergic to any medication. Please tell them if you are, even if they don't ask you the question, because otherwise you'll be getting something that will give you allergy and anaphylactic shock. So don't do that. So that's where strep throat. Obviously, it's not that simple as just like, oh, if it's a bacteria, it's strep throat, and if it's a virus, it's completely okay. Because there is the Epstein-Barr virus, which is mononucleosis. So we don't want to have mononucleosis. Usually when people have mono, there is a test that you can take for that, but usually it's like you really have a hard time talking, and like your throat is really swollen, and a lot of problems. It's not very similar to regular viral infection. Regular viral infection, you can have a cough, you can have redness in your throat, having trouble swallowing, and you can have also problems with after sores in your throat, or it's kind of burns, and usually it also comes with like your nose is running, or your eyes are running, or that kind of thing. Other reasons why you could have pain in your throat is because of allergies, or because you have a streptococcal infection that's only one-sided. And if you have troubles opening your mouth or talking, or you have only trouble on one side of your throat and not the other, check with your doctor as well, because they can look inside your throat, see if it's asymmetrical, and see if you should see a throat specialist. So that is about throat infections. And next we get into nose and sinus infections. And it's often that it feels heavy in the cheeks, but that is not actually a criteria for this. The most important criteria is that it goes down from your throat into, like, from your nose down to your throat, that it has been at least 10 days since this started. Otherwise it's just a cold, and you cannot say that it's a bacterial infection unless it has gone over 10 days. And then the medication is often penicillin, but there are other kinds of antibiotics. Sometimes the doctor might need to do an X-ray to check in your sinuses. Usually you have to have a fever. Usually it's one-sided of your face, so not both. You might have both sides, but mostly on one side. And it can be in your your cheek, but also in your forehead and behind your nose. Often these things take a very long time to get better on their own, but it has to have gone 10 days in order to get the diagnosis like sinus infection. Otherwise, it's just a viral infection or a cold. That's according to us, at least, here in Sweden and at my clinic. That's about your nose. So we've gone from throat, we've gone to nose. Let's go to ear. Ear infection is like pretty basic. We look into your ear, we see how it looks like. If it looks like an ear infection, we give medication. It's slightly different if with antibiotics. It's slightly different if you're between the ages of 1 to 12, because oftentimes we'll ask parents to wait a few days more, because usually these things stop on their own. Sometimes what might happen is that your eardrum might pop, and you might have a perforated eardrum, and usually it's when it's a really bad ear infection, and then when it pops, then suddenly you get some kind of weird relief, because like all the pressure that's been built in with all the stuff that was behind your eardrum releases, and you might get a kind of discharge that comes from your ear. Not all discharge is because of an ear perforation. It's sometimes it's just earwax, okay? But if you see blood, then that's also not a good sign. And often you have fever and it really hurts in your ear, and so check that out, because you can get antibiotics for that. Certain people have a lot of these ear infections and have it again and again, and maybe need to see an ear specialist. So ask your doctor about that. When it comes to other problems in your ear, another problem is like when it itches in your ear. And itching in the ear is often airway eczema. So like the skin inside your ear is dry and irritated, and there are ear drops with cortisone that you can use. Do not use like put anything inside your ear, because that can lead to problems. The only thing that I would maybe advise to put inside your ear is if you have a lot of discharge and that it blocks your ear, you can use like cotton wads and put some like cleaning. I forget what it's called in English, but it's like a disinfection stuff. And then you put that in your ear, and it's like sucks up all of the discharge. But that's only if you have discharge. Otherwise, if it's like dry in there, do not put anything in your ear. If you have earwax, do not put anything in your ear. It will make it more stuck. Avoid getting water inside your ear, because that can actually lead to more problems with eczema in your ear. But not all ear pain is ear infection that needs to be treated with antibiotics. Most ear problems are actually because of a cold, and that it goes from your nose to your ears. And the actual treatment for that is nose spray, because the nose is coupled to your ears, and since the fluid that's behind your eardrum cannot just go out from your eardrum, because it's closed off. That's the reason the eardrum is there. The only way it can get out is through the nose and through the throat. So that's why using nose spray will like make all the water in there come out through the nose, through the throat, and will like be rinsed off. So that's what we call autosalpingitis, which just means an inflammation in the airways, basically. So that is about ears, nose, throat. And then we have the lungs. But the lungs there, it's kind of important to go to your doctor, so I won't be going too much into this. But often it's fever, often it's coughing up a lot of slimy stuff that's often yellow, and it can go differently fast. Often you have trouble breathing because of this cough and all sorts of things. If you have asthma, it might get even worse. If you have COPD, it might be really terrible and you need to actually go to a doctor and sometimes even to the hospital. There are different antibiotics for this. In Sweden, we don't have that much antibiotic resistance, so we can use regular penicillin for most lung infections, but that is absolutely not the case in other countries. So talk to your doctor and make them listen to your lungs. Maybe do a lung x-ray to see if there's problems with the lung tissue, and make sure that you can breathe. Obviously, COVID has been something that has led to problems with your lungs, but that can't be treated with antibiotics. So do take a COVID test when this happens. And also, like, it's not always that you will get antibiotics for what you want, but usually when it's lung infection, that's pretty obvious to everybody. So that's about the lungs. So we've talked about all of the airway infections. Tell me what you guys think. Is there any topic that you want me to cover? I'll tell you if I can cover that or not, or if I'll refer you to another medical professional. I do not know you guys. I do not know your health problems, and I do not want to know your medical problems online, because they might, it might be medical secrecy about all this, and I don't want to, go to a doctor who is sworn to medical secrecy with you, who can actually document this into the medical history for future doctors to be able to help you. Also, I cannot listen to your lungs or that kind of thing online. So I'll send you towards your doctor. But I can answer certain very general, vague questions. So have a great day, everybody. Bye.